And you know what I might do is I might. I was just thinking that we did a little hormone panel on this patient. I might use her as a little case study. We could talk about some different ideas for natural ways to help some of her stuff, right?
Right, exactly.
That would be kind of fun. Because I know what I'm doing already, but that could be kind of a cool thing that people might be interested in.
Yeah, like our thought process and how we even decide what to do.
Yeah, that's a really good point. Because she's actually, this is a really good case study. She's, 43, and she's diabetic.
So yeah,
she wants to get pregnant, right? And her hormones are
right, maybe. But yeah, so she's 43 and wants to get pregnant.
Yes, for the first time. But she and her husband decide that she's on birth control, and she wants to wait because they're going to sell their house and buy a house in Katy. So she wants to wait till next year. I am trying really hard to just not bite my tongue and not say too much because.
No, I'd scream no. I'd be like, no, I don't bite my tongue. I'm just like, months matter, dear. As a matter of fact, like if somebody were 40, like I would say no, like a decade ago, if I were 40 and said, oh, I want to get pregnant, let me go to an infertility doctor's office, they'd be like, get out. Now they push the age to 43, so they don't tell you to get out till 43. So she wants to wait till 44. The problem is if she doesn't get pregnant naturally, she won't find anyone who will even think about helping her. Yeah. Because that's just the statistically speaking, it's just that bad. Like at least at 43, it's low, but they're like, we'll try for a miracle. Yeah, but at 44, so that's why I tell them that because
44. She just turned 44 in February.
Oh, right. So yeah, I tell them that just because like if that information matters now rather than in a year, I'm like, well, you know what, you should have. I'll be like, let me tell you this because that's just how it works.
I did tell her, and I'm not supposed to tell her about medications, but prescription things. But I did tell her birth control. I'm like, she's happily married, and y'all are really considering having a baby at all. Stop it, like, please.
Right.
I'm like, because there's always this God portion of it too, right? And if it happens beforehand, it's not a bad thing.
Right. Because you've already spent all this money on a house. You don't want to spend all this money trying to pay the doctor to help you have a baby if you can, make use of your, fertility and, take some stuff.